How do we deal with the elderly and an opioid addiction? This is a very difficult situation because most of the time they are on this medication because of chronic pain. Chronic pain is ubiquitous, it's very common amongst the elderly. And just because they're on long-term opioids does not mean that they are necessarily addicted. So that needs to be thought of first. Is there an actual addiction? The signs of addiction is when a person is hiding their use, if they're lying about it, if they're deceiving others, if there's times when they're overly medicated. This is evidenced by sedation, excessive sleepiness, falls, for example. So this is a unique situation and great care needs to be employed. It needs to be discussed best with their prescriber of the opioid. So we need to get down to brass tacks. Why are they on the opioids in the first place? Is it a good idea to wean them? You know, there's nothing wrong with trying a wean very, very gradually to taper the amount that they're taking. A lot of times people have been on these medications for a long time and they become reliant on them and they don't realize that there are new alternatives and that they can have a better quality of life if the dose is reduced. So, and yet in other people, it's, you know, quality of life, and if they've been living with long-term pain, sometimes not meddling with their medications and just leaving things alone is okay too. So it comes down to quality of life. What is it that they want? What is it that you want? By being on a long-term opioids does not mean that they're necessarily addicted. They might be physiologically dependent on it, meaning that if you were to suddenly stop giving them their opioid, they will go through withdrawal. That's a different situation altogether. If it is deemed, though, that there is an addiction going on, that there's manipulative behaviors, they're lying, deceiving, overly taking the medications, sedation, falls, then in this situation, then yes, this information needs to be conveyed to their family doctor, and then a plan needs to be involved. Generally, you want to involve them in their own plan, but some elderly people, it's best not to include them in this, and I don't recommend this at all, but in the unique situation, sometimes it's best to just try to taper the dose very, very gradually and keep a very close eye on them. The goal in this situation is to reduce the consequences, things like falls and altered mental status and excessive sleeping, but giving them a better quality of life, but at the same time making sure that they're not suffering through opioid withdrawal. And that can be very uncomfortable, and in the elderly can be fraught with serious side effects. An actual withdrawal itself should take place in a hospital. This is not for detox, not for a rehab facility. This should take place in a hospital with properly trained staff who can closely monitor your loved one for any complications. So to summarize this, dealing with the elderly with opioid addiction, actually one thing I need to add here before summarizing is that opioid replacement therapy is another arm that's now more commonly used. And what I mean by opioid replacement is putting them on a substitute instead of the drug of choice with, let's say, hydromorphone or morphine, for example, is to slowly wean them down from their dose and then substitute it with an opioid replacement therapy so they're not going to go through withdrawal. It's one or the other. And generally with the elderly, I think most of the time it's a wean of their normal medications or a slight change in their medications, whereas in unique situations they may be switched over to an opioid replacement therapy. The difference is the opioid replacement therapy may not confer as much of a pain control measure, and you can put them into a more severe withdrawal if they're being switched over, so that may not be an ideal approach. So I hope that hasn't been confusing, but the idea is to either wean them down off their normal opioids to a more manageable level so they're not having any complications, or switching them over to an opioid replacement therapy, but the problem with that is that they will likely go through withdrawal, but it could be for a short time, and this can be treated in the hospital. So one does not confer any benefit over the other. Now to summarize this again, dealing with the elderly and opioid addiction or dependency is a very complicated situation fraught with hazards. It's best to speak with your healthcare provider who's prescribing the opioid to discuss with them and your loved one what it is that they would like to do. Is it best to keep them on their long-term medications Is it better to try to wean them down because of complications that are going on? Is it better to put them through a short-term detox, minimizing the amount of stress on their body, but to get them fully off the opioid? And then finally, if this is somebody who's has enough strength, then at this point, once they're clear-headed, there's nothing wrong with going on to treatment into a long-term rehab. All of the above can certainly improve the quality of life. And if you have any questions or comments about what I've discussed, because there's lots here, please feel free to leave it in the comment box below. Thank you.
If you or a loved one are looking for help with substance abuse, call our 24/7 helpline at 1-800-615-1067. A caring addiction advisor is awaiting your call.